So today we're going to be doing an assessment on our child here. So the first thing we're going to do is we're going to read about our patient, get to know him a little bit before we go ahead and go into the room. So I'm going to either get handoff report or I'm going to have their chart pulled up. So I'm going to read what their diagnosis is or if they have any disease processes going on. I'm going to look at their name, their age, if they have any allergies, and then why they're here, most importantly. So after I read about my patient, I'm going to go ahead and go into the room. I'm going to knock, introduce myself. I'm going to wash my hands, and I'm going to identify my patient, make sure we're in the right room. I'm going to talk to both the patient and the caregiver because usually at this age of a child, it's trust versus mistrust. So they're very on edge, probably a little scared, maybe timid. So I want to make sure that they feel comfortable and that, I'm talking clear and slow and making sure that if they do feel uncomfortable, that I'm going to get down on their level and talk them through what I'm going to be doing while I do an assessment on them. So I'm going to be explaining to them that I'm just going to take a set of vitals. I'll let them play with my stethoscope if they want. I'll let them take my blood pressure, like the whole thing. So everything I'm going to do, I'm going to tell them. And then if they are okay with that, then I'll go ahead and go on with my assessment. But if they're not, then I'll let them kind of perform an assessment on me. So as I come into the room, I'm going to be looking at the child and, looking at their posture, trying to figure out how they're feeling, and also looking for any sort of deformity or maybe some bruising, anything of that nature. So after I have introduced myself, formed a report with my patient, I'm going to go ahead and start my vitals. So I'm going to take their temperature, so usually tympanically. So we're going to take a temp in the ear, and then I'm going to feel for their pulse and count it for a full minute. And then after that, I'm going to apply my blood pressure cuff, take their blood pressure. And usually when I'm doing that, I'm going to be watching their chest movements. So I'm also performing a double assessment. So I'm going to look for their respirations and count those for a full minute as well. And I'm going to be looking at how their chest is expanding and look for any sort of maybe retractions or any sort of deformity that maybe their lungs aren't expanding and collapsing appropriately. So after I do my vital signs, I'm going to go ahead and start my head to toe assessment. So I'm going to be looking at their head, looking for any sort of deformities. I'm going to be checking the skin color, the shape. Is their head symmetrical? I'm going to be looking at the ears, making sure there's no drainage or discharge. Making sure that the ears are also symmetrical. Along with their nose, I'm going to make sure that their nose looks pink and moist and it's not running. Do they have a cough, cold? Is there some kind of discharge and what the discharge looks like? I'm then going to assess their eyes, making sure their eyes are symmetrical with their bridge of their nose. I'm also going to take my pen light and making sure first that they're comfortable. Like I said, I will explain everything I'll be doing. So I'll take my pen light and I'll be looking in their eyes, looking for perla. So we're looking for the pupil, the roundness of it, perla. So the pupil, if they're equal, round, we're looking for light sensitivity. Sorry, I forgot perla for a second. Light sensitivity and accommodation. So if their eyes are accommodating to the light. Next thing I'm going to do is I'm going to be looking in their mouth and making sure I'm looking for like signs of dehydration. So making sure that the mouth is nice and pink and moist, and I don't see any sort of like thrush or like white patches, maybe for strep or something. They could have a sore throat. So I'll be looking in their mouth for that. Let's see. So then I'm going to go ahead and ask if they feel comfortable. I'm going to be assessing their body. So I'm going to move down towards their body. I'm going to be making sure that I'm listening to their heart for a full minute at the apex. So I'll be listening for a full minute to their heart. And I'm listening for any sort of murmurs or anything that doesn't sound like it's not in a good rhythm. I'm going to be, like I said, looking at their chest, making sure there's no retractions, making sure everything is equally expanding and contracting. I'm also going to be listening to their breath sounds. So I'm going to be listening in all of their lobes. So I'll be listening to them take breaths, making sure that I'm listening while they're inspiring and exhaling the whole time. So I'll be going through all the lobes, making sure everything sounds clear. So no crackles or rhonchi, wheezing, anything of that nature. I would know in their chart if they had any sort of asthma or some kind of respiratory infection. So I'll know that. Next thing I'm going to do is I'm going to listen to their bowels. And so I'm going to listen in all 4 quadrants of their bowels, listening to see if they are hyperactive, hypoactive. So I hear all 4 bowel movement, or all 4 quadrants. And then I'm going to palpate, making sure I don't feel any sort of masses, maybe hernia, something along that nature. While I'm doing all of these physical assessment criteria, I'm going to make sure that their skin looks warm, feel that their skin's warm, making sure, the skin has good turgor, making sure that, they're hydrated still. So while I'm performing this physical assessment, I'm assessing like the skin, the color, the texture, and the temperature of the skin. So as we listen to the bowel sounds and palpated, I'm then going to move towards the extremities. So I'm going to be looking again at the skin color, the texture, the temperature. I'm going to be feeling the pulses. So we have our radial pulse, and then I'll feel the brachial. We're looking for if their pulse is strong or weak. So I'm going to do it in the other arm as well. Feeling their pulses. I'm checking for capillary refill as well. So we want less than 3 seconds is the perfect number. So we assessed our arms. Making sure again that everything is symmetrical. So making sure their arms are all symmetrical and everything of that nature. We're going to go ahead and move down to their legs, making sure there's no swelling and bruising. Again, we're looking at the color, the texture, the temperature, making sure everything feels warm, making sure there's good circulation. So I'll feel their pedal pulse and post-tibial. And we're again looking for is their pulse strong, weak, moderate. And then we're doing capillary refill again. We're looking at the nail beds. And we want 3 seconds. So that's all good there. And then we're going to go ahead and make sure the patient's comfortable. We're going to assess their genitalia. So we're going to make sure we're looking at there's no skin breakdown. So no like diaper rash or, just redness or swelling, something that could be causing irritation to the skin. So we'll make sure that everything looks good, symmetrical, check the buttocks, and make sure everything looks correct and in the correct position. And then I'm gonna make sure that I'm always checking in with the parents as well, keeping them informed of what I'm doing and why I'm doing it, and just making sure that the child's comfortable the whole time.